Action Behavior Centers is the leading chain of ABA, or Applied Behavior Analysis Centers in the United States. We work with young children, specifically those generally between ages 2 years old to 6 years old, who are more severely affected by autism spectrum disorder.
Autism spectrum disorder is a developmental disorder that affects kiddos at a pretty early age. Autism will affect their language development, their social skills, and you'll typically see some repetitive behaviors.
Our mission is to help children with autism spectrum disorder reach their highest potential.
Action Behavior Centers was founded to be able to offer the highest quality level of ABA therapy that can be found anywhere in the United States.
So when a kiddo starts ABA therapy, we typically focus on behaviors related to noncompliance, something that's repetitive.
We do anything from reinforcing positive behaviors to trying to reduce maladaptive behaviors.
And we also work on teaching new tasks.
Potty training or feeding or social skills, working with peers.
Sometimes it's learning how to try new foods.
I've seen kids who only were eating 2 things, chicken nuggets and French fries, and now they're eating 10 different foods, including fruits and vegetables. So it's a mix of working one-on-one with their therapist, but also lots of opportunity for socialization with their peers there and in groups with the other therapists.
We try and make a typical day at ABC look a lot like what a daycare or a school would look like. That way these kids have an easy transition onto the next phase in their life.
But they're always with a one-on-one support person to help make sure they're not missing any learning opportunities throughout the day.
We prepare children to learn in a way that's very individualized, and we tailor their learning to exactly what they need.
Our no waitlist policy basically means that we get children in as quickly as possible and they don't have to wait to start services.
The early years are when intervention is the most important because it's when you can make the biggest impact. So the sooner a kiddo can get into therapy, the better the treatment outcomes are going to be. So the insurance process at ABC, it's pretty simple.
We have a huge force of employees that work behind the scenes. Our psychologists, including myself, help with any updated diagnostic needs so that parents aren't having to interrupt their child's intervention and go out and seek an outside evaluation. One amazing thing that Action Behavior Centers provides is free ADOS assessments to the community. It's considered right now one of the gold standard assessment tools that can help in the process of diagnosing autism spectrum disorder.
You know, the kiddo comes in, you set up the environment to figure out how they react to certain toys, how they react to a new person, and in that time you're observing their behavior, and then that gives you the likelihood of the presence of an autism diagnosis.
My favorite part of the job is seeing a kiddo tackle something that is initially very difficult and then having them finally get it.
You really get to see those milestones that kiddos bust through as we're helping them to acquire new skills.
One thing that's always fun to see is all of the therapists in the waiting room waiting for their child to come in and seeing kids light up when they see their therapist.
With the caseloads being so small, they really have the opportunity to give that kiddo all the attention and treatment that they need.
They're not just teaching them, but they're taking care of them and loving them as well.